Good morning, I'm Dilhani Ekanayake. Today my presentation will be about the preliminary study on eye lesions in dogs with chronic renal failure. In chronic renal failure, there's a prolonged irreversible impairment of kidneys resulting these consequences that give rise to extrarenal lesions. Although some studies have suggested that there is an increased risk of ocular complications in human renal failure patients, there are no histological studies in humans, and this relationship was not studied in animals with chronic renal failure. Therefore, in novelty, the objective of our study is to conduct a comparative and qualitative analysis of pathological changes in lens, retina, and choroid of the eyes in renal failure dogs. In our study, we have collected kidney and eye specimens from 12 dogs brought to Department of Veterinary Pathobiology for necropsy examination. Following selection by using clinical history supported with serum creatinine and BUN levels, chronic renal failure was confirmed using gross lesions, and the collected specimens were then fixed in formalin for 48 hours. Following sample processing, the specimens were stained with HE for identification of general lesions and later with Mason's trichrome staining to confirm specific lesions like fibrosis. In our study, we have analyzed our data in a systematic way, beginning with eye staging of renal failure using serum creatinine levels. And the observed renal lesions were compared with the iris stages and then categorized based on their severity. On the other hand, the observed eye lesions were categorized based on their severity and finally compared with the renal pathology. Before moving on to the results section, let's get a quick view of how normal histology of kidney parenchyma looks like. When we consider renal pathology, we have observed these salient lesions in renal parenchyma of all cases, and these were used to compare the progression of renal pathology along with iris staging. This is an image of the renal cortex where you can see the interstitial infiltration of mononuclear cells around a sclerotic glomeruli. And in this region, you can see the degenerating tubules with mild atrophy. And we have confirmed corticomedullary fibrosis using Mason's trichrome stain where the collagen fibers are stained in blue color. When we compare these lesions, all of them have shown a progression along with iris stages, but the interstitial inflammation was less evident in stage 4. And some other lesions like nephrocalcinosis, which is the metastatic calcification of renal tubules, accumulation of protein-like material in capsular spaces, cellular casts, and renal amyloidosis were evident in some cases. Before moving on to the most significant part, the eye lesions, let's get a quick view of how normal histology of posterior eye looks like. And here you can see the retina followed by the choroid and the sclera. So when we consider eye lesions, the gross pathological lesions were less evident in retina, although lens opacifications were detected in 2 cases with a history of bilateral cataract. And the histological lesions were prominent in retina and choroid, but unfortunately we were unable to observe the microanatomy of lens specimens since most of them had been accidentally trimmed off during processing. So when we consider the choroidal histopathology, 90% of the cases had a variable fibrosis, with some having fibrosis around choroidal vessels and some having a cellular proliferation at the level of retinal pigmented epithelium. And these choroidal lesions were then categorized based on the extent of fibrosis in the choroids, and they were categorized from mild to severe forms. This is a section with severe choroidal fibrosis where you can see a prominent fibrosis around the blood vessels, and here you can see the choroidal neovascularization, which is the emergence of blood vessels through defective root membrane. And in this region you can see a cellular proliferation at the level of retinal pigmented epithelium. This is a degenerating retina, which will be discussed later in our results section. And we have performed Mason's trichrome staining to stain collagen in choroid fibrosis. Here you can see a prominent fibrosis in the choroid and around the choroidal vessels as well. So when we compare these choroidal lesions, they have shown a progression along with the severity of renal pathology. And some additional lesions like diffuse chromatia, choroidal atrophy and hyperchromatia were observed in some cases. When we consider retinal lesions, retinal detachment was the most significant lesion observed in 70% of cases. In addition, retinal degeneration and retinal atrophy were observed in some cases with retinal detachment. Most importantly, retinal detachment was observed in many cases who had fibrotic choroids. This retinal detachment occurs as a result of separation of neuroretina from the retinal pigmented epithelial cell. And this tombstoning appearance of RPE cells occur due to cellular hypertrophy following retinal detachment. In some cases, retinal degeneration with mild atrophy was observed in retina, especially in ganglion and inner nuclear cell layers. So as displayed over here, features like intermixing of retinal layers, reduced thickness of the retina, and loss of normal retinal architecture were prominent during retinal atrophy. And here you can see a prominent cellular proliferation at the level of retinal pigmented epithelium and a severely fibrotic choroid. So these retinal lesions were categorized based on their progression from detachment to atrophy as mild to severe form. So when we compare these lesions with renal pathology, retinal degeneration following retinal detachment was observed in all severities of renal pathology. But retinal atrophy was detected only in some cases with moderate and severe renal pathologies. And unlike choroidal lesions, retinal lesions have shown a variable progression along with renal pathology. As I mentioned earlier, chronic renal failure gives rise to many consequences that lead to multisystemic extrarenal lesions. Also, these ocular pathologies are commonly encountered in renal failure human patients. And in our study, we have observed similar eye lesions in renal failure dogs, especially in choroid and retina, and there's a possibility to have such lesions in the lens as well. Therefore, in novelty, these eye lesions can be observed in renal failure dogs. So it is important to consider about ocular lesions in renal failure patients to improve their well-being. And also we need continuous studies in the future to find the exact pathogenesis and association between these eye lesions and renal failure. So in conclusion, we have observed these eye lesions in choroid and retina of dogs with renal failure. And these lesions have shown a variable progression along with the renal pathology. Therefore, it is important to focus on clinical examination to assess the vision status of renal failure patients. Furthermore, we can control these eye conditions by effective management of renal failure, and it is necessary to diagnose these conditions much earlier to minimize the extrarenal impact on eyes. Thereby, we can improve the welfare of these renal failure patients in a much effective way. So these are my key references, and I would like to acknowledge these personnel for their support throughout this study. And that's the end of my presentation. Thank you very much.